She wrote an article. Her name is Anna Malino. And Anna Malino wrote a piece for Common Dreams called Marketplace Subsidies, Poll Tax on the Poor, Giveaways for the Rich. Subsidizing the for-profit insurance industry with taxpayer dollars is a disaster that must not continue. Whether you are Republican or Democrat, this matters to you. So I'm going to ask everybody here that's listening to this, take off your ideological lens, take off your ideological glass, and listen to this intently. When the Biden administration ended the COVID-19 public health emergency in March 2023, for over 20 million poor children and adults on Medicaid through Medicaid unwinding, it had just extended exchange health insurance subsidies, which provided billions of taxpayer dollars to health insurance companies for the same pandemic. In other words, during the Biden administration, and you know that we had the pandemic, we used the pandemic to get a whole lot of Americans, because there are millions of Americans that were uninsured. They didn't have health care. Well, because of the pandemic, that was a good entry into giving people health care. We want people healthy, right? Now, nowhere is the dictum socialism for the rich and capitalism for the poor more apparent than in the decision to end continuous enrollment in Medicaid, which protected millions of poor children and adults during the pandemic from being kicked off Medicaid, and to enhance and then continue the exchange health insurance subsidies through the Inflation Reduction Act. Again, remember what happened here. We had They stopped that automatic enrollment into Medicaid expansion, and now you had to go fight for it to see how best you could qualify for it. Now, you had to make this huge effort, whether you're poor, you're almost poor, or whatever. A lot of people still got the Medicaid, but I want to continue here. But KFF.org, a nonprofit health policy research, polling, and news organization, is sounding the alarm. The results of the 2024 elections will likely play a major role in whether the enhanced subsidies are extended beyond 2025. Meaning, vote for the Democratic candidate or these subsidies will be cut off. This is not a statement of hyperbole. These are statements of fact. Let me continue. Who benefits from the subsidies on the exchanges, also aptly called the marketplace? You know, when you go to healthcare.gov, you get the marketplace. This marketplace is all the insurance companies throw the plans that they've selected for people onto this marketplace. And supposedly now the American population who don't get insurance from their companies, which now are most, can go on this marketplace and shop for the best deal for insurance that they pay. And depending on how much you make, some of it is subsidized by the government. So let's continue. Yes. People who earn too much to qualify for Medicaid, or who live in states which have not expanded the Medicaid, but not enough to pay for private health insurance, benefit to some extent, but only in a warped kind of way, depending on their level of poverty. These individuals and their families might qualify for zero premium monthly payment with a hefty deductible. KFF.org has a nifty calculator where you plug in your state, income, and size of family and figure out how much a silver plan will cost you. Keep reading the fine print, because even if you have zero monthly premiums, listen well here, folks. I need you to listen here. When you're going on to the marketplace, the Affordable Care Act, to shop, you may get a zero monthly income premium because, again, you're too poor for to pay the premium, but your out-of-pocket annual cost could be as high as $6,300 anyway, because there's a deductible. This means that you pay per year 6.3% of your annual income before the insurance company starts to pay a penny for your care. Poor people benefit if they don't get sick, but if they do get sick, now is where they pay out the gazoo. How much would a family of four earning about $40,000 pay per year, pay for the silver plan without subsidies from the exchange? About $1,400 per month. Wait, Is the insurance company giving poor people premiums for free? No, not at all. The government, using tax dollars, pays the insurance company $1,400 for the monthly premium. The government pays the insurance company $17,796 annually to provide the family with a silver plan, plus the family pays $6,300 out of pocket if they need health care before the insurance company pays a penny. In other words, before the insurance company starts to pay a penny for your health care, they have already made $24,000 every year for your family. I want you to understand when these insurance companies are trying to tell you the government is trying to socialize your medicine, or you have the right-wing groups trying to tell you you're socialist because you want Medicare for all. You want to have a system that doesn't just give the insurance companies a lot of money. I want you to understand this, what we're discussing here in detail. The insurance company, before they have to pay a penny, get a minimum of $17,796 a year, or if you get sick, up to $24,000 a year before they have to pay a penny. And remember, they also negotiate on the back end with the provider. They tell the hospital, we're not going to give you $500 for the room. We're going to give you $200 for the room. I mean, so again, these are people, health insurance companies. It's an industry that creates nothing, makes nothing, serves nothing, gives nothing. But before anything exchanges, they get $24,000 in their pockets. You want to know why they fight so much to keep you dumb? To make you believe that Medicare for all is socialized medicine and it's going to be bad for you? Because they've got a cash cow in you via your government and via your deductibles. $24,000 before a penny is paid out on your behalf. In 2022, health insurance companies offering plans through the exchanges made $20 billion. If the subsidies are extended permanently, as KFF suggests, the price tag, according to the congressional budget, will be closer to $28 billion to these companies. Think about this, folks. I want you to think straight. All these companies do is they are a conduit between you and your health care. So they extract $28 billion for paying a bill that your government can pay with one entity and you can pay via your taxes. And they try to make it seem like they're doing you a favor to protect you from healthcare socialism, socialized medicine. People, the reason they need you dumb is because that's the way they can pilfer you. That is the way they can take your money right out of your pockets. You work hard every single day. There is a more equitable, much less expensive way to fix this. Eliminate health insurance companies altogether. They don't provide a service to you. They do not provide, the hospital provides a service, the doctors provide a service, even the equipment manufacturers provide a service, even though drug companies and these other guys need to be tailored in because most of the design and the technology that goes into these products were designed on and invented. The intellect came from you. You're the one who paid all the universities where these things are developed. Again, people, they need you dumb. What we try to do here is educate everyone on how things really work. And in doing so, you can make the appropriate political choices so that they can no longer have the few, the corporate state, pilfer you, rob you, steal from you legally. Brothers and sisters, please, this is not an ideological issue. This is a common sense issue once you're educated. This is an issue where we have been fooled, indoctrinated for decades upon decades upon decades. And the reason you don't hear this often in this detail on mainstream media is because you don't slap the hands that feed you. And if you take a look, every other commercial is a healthcare commercial, is an insurance, it's a drug. It's one of these guys that are funding an inordinate amount of money. And part of that money, that inordinate amount of money, is to keep you dumb.
We spend a lot of time deconstructing the news, trying to parse it into a form that everybody can understand. We try to find those little nitpicks where it flies above the fray, etc. If you really like these videos that we do, I want to ask a big favor. Please go ahead. Number one, subscribe to our channel, and number two, please join if you can. Thank you so kindly for watching. Keep watching. Please remember to share. We must populate the entire internet with our progressive message, a message that we know is what most Americans say that they want. So help us, please join.